What brought you to Dubai?
So I follow my ex-boyfriend.
Okay,
That's not the
that's a
question.
that's a secret. Welcome to the first episode of our brand new podcast, Pearls of Wisdom, in association with Pearl Dental Clinic. My name is Dr. Salah, and today we have a lovely guest, Sophie, a physiotherapist and a nutritionist at Noralign. Sophie, introduce yourself.
Thank you, doctor, for inviting me for your first podcast. I'm physiotherapist and nutritionist. I'm working in Dubai since almost 2 years. So what is interesting, it's because obviously when you change country, you learn a lot. You learn a lot professionally, so in your work. But you learn a lot also about yourself. So finally, it's you grow. I say in the both field.
Okay. So you started off as a physiotherapist.
Yes. So first I studied physiotherapy. I did my 2 master in physio and physiotherapy of sport. Then I study also manual therapy, which is a part of osteopathy.
Okay.
And in this area, I specialized in visceral therapy, so which we work on the
Organs. Oh, that's very interesting. Is it a new field?
It's a part of osteopathy, actually. So all of the osteopaths know this, but yes, people are not aware. We can work on the digest system. We can work on the pericard, which is around the heart, the kidney. We can help with.
Nice, very interesting.
Voilà.
Okay, and what's your journey into nutrition? How did you come into?
So I start to study nutrition because when I was young, I struggled a bit with food. And I said to myself, if I want to cure myself, I need to, because I'm very scientific, so I need to understand what exactly happened in my body, in myself, in my cells when I eat. What is the effect? And I start to study, so first biochemistry and things like that. And I realized food is really powerful. The more I study, because I'm still studying, the more I said to myself, now I know all of this. I need to help people with that because it's really powerful.
So what happens when you go to a restaurant?
Nothing. So when I'm going, yes, this is the other part of nutritionist. When I'm look a plate, I see in my plate polyphenol, antioxidant, fiber. Yes, so it's a bit like this, but we also enjoy if we need to eat. Any kind of food, we eat it anyway.
All right. Okay. So let's get back into our main topic of the day. That is, we talk about nutrition and the wellness. All right. So why nutrition is an important factor in maintaining good health?
I think everybody knows the sentence, we are what we eat, and it's exactly that. The body uses the food as a fuel, actually, and all the mineral, all the vitamin, the protein, lipid, sugar you need for your cells come from your food. So food can be your best ally as your best enemy.
Wow.
So
Okay, that's very powerful. How does nutrition directly affects your gums and your teeth?
in your mouth, you have bacteria. We call that microbiota. So it's bacteria. Obviously, this is the first barrier to protect when you put food in your mouth. And you have also saliva inside. And both, they work together. So your bacteria, your saliva are here to manage the food you ingest, to protect all the teeth and the gum.
So like, say, for example, like now what I tell my patients are like, we need to chew very well. You need to eat very well.
Yes. So because we have this microbiota in this saliva, and actually the composition of the saliva and the microbiota were here to protect your teeth and your gum against acidity, for example. but the composition of that's clearly linked to what you eat actually. So if you eat bad food, let's say a lot of sugar, bad fat, etc., the composition of your microbiota change. So you have more bacteria, we call bad bacteria, especially Streptococcus mutant. And these bad bacteria create a disbalance in this microbiota with too many bad bacteria and not enough good bacteria. And then the saliva is less efficient to protect your teeth and your gum, and it disrupts as well the digestive function of the saliva. So it has an impact in
reduces
everything.
the digestive function of the
Exactly.
saliva, right?
Yes.
And Streptococcus mutans, interesting that, it's one of the most important bacteria that is the cause of cavities.
Exactly.
Yeah. So there you go.
Voilà.
Voila. I need to say that as well. So are there any specific vitamins or minerals that play a crucial role in our dental health?
So the most important are obviously calcium and phosphorus, but we have also vitamin like vitamin A, K, and D, and fluoride as well. Well, calcium and phosphorus because the dentine and the enamel are done with calcium and phosphorus, so that's why we need it. Vitamin K and D, you need it to create bone actually. Well, it's one of the functions.
So once the bone is formed, do you think, as adults, for growing children is different, but as for adults, once the bone is completely formed, does this minerals actually still keep supporting the bone?
Yes, exactly. Yes, because as I said, so when you eat, you have always, and for other reasons like cigarette, alcohol, or whatever, each day your teeth are confronted to acidity, to attack acid.
Yes.
So acid attack, sorry. So you need to have a kind of reservoir, a stock in phosphorus and calcium to it's
To
always a balance.
remineralize
Yes, exactly. So it's demineralization, remineralization every day. So voilà. So we need it, and that's why we need also vitamin K and D are very important for that. Vitamin A, it's also because the transporter for the vitamin D need vitamin A, but it's also because it's important for the enamel. Enamel, yes.
And fluoride, I know this is very controversial. Like when you go through Google, you'll find a lot of negativity towards this special but lots of studies have proven that fluoride is essential to protect the teeth from cavities. That's why most of the dentists recommend using fluoride toothpaste. So what is your take on this? Like how much of a fluoride is actually required as an adult?
4 milligrams per day maximum, okay? So with a toothpaste, we are more than 4 milligrams of fluoride per day. So this is my opinion. The problem is now we have fluoride in the floor, in the water, in all of other things we ingest. Yes.
True.
So this is the problem, and we are clearly quickly more than 4 milligrams. Now, I will share my own experience because when I learn nutrition, yes, the teacher aware us, be careful with fluoride, don't use toothpaste with fluoride, it's really bad. And so I did my toothpaste by myself without fluoride, and I use it for months. And after maybe 6 weeks, I have teeth were broke. I went to the dentist and she said, what do you use as a toothpaste? And I explained to her, and she said, it's probably because you should alternate with toothpaste with fluoride and without. So I think anyway, nobody use all the toothpaste. If you put a small amount of toothpaste, you are safe. Yes, exactly. And it's good for your teeth. I learned from mistake.
All right. Okay. So what does a balanced diet or optimal health looks like?
So, alors, there is a very well-known diet we call a Mediterranean diet. So it's not like what people eat in Greece. No, we call that like this in the scientific area. So basically, it's vegetable for every meal, lunch and dinner, 1 or 2 fruits per day. Try to have day without meat, vegetarian day. Very important, it's to eat 2 or 3 times per week small fatty fish. So sardinas, mackerel, herring. And why it's very important? It's very important because you have omega-3. And it's the only food you have omega-3 immediately available for your body. And reduce the salt and use many spices. Like I love ginger, cinnamon, turmeric. This is my favorite spices because they have anti-inflammatory, antioxidant benefit.
Wow. Are there any particularly beneficial foods that can help with promoting strong teeth and gums?
I think eating raw vegetable and raw fruit, it's good for teeth because you have to chew a lot. It gives some auto-cleaning of your teeth.
Teeth as well, yes. And it produces more saliva.
Exactly, which is very, very important. Obviously, as I mentioned, we need vitamin A, D, K. So we can find it in the food. For example, vitamin A, it's more in the liver of meat of fish. So I think you just need to diversify your food and it will be fine.
And we all know that sugar has a negative side effects on the teeth, right? Can you explain how sugar impacts oral health and how to minimize its effects?
So first you have to know that all the sugar are not the same effect on your teeth. Okay, so the one who have a bad effect, it's the one who have fermentable. Okay, so that means the bacteria you have in your mouth, depending of your microbiota, they will use the sugar, they will ferment the sugar. Okay, with this fermentation, they will create a kind of substance on the top of your, on the surface of your teeth,
yes,
who attract other bacteria. So if your microbiota is not good, for example, because you eat a lot of sugar, it will be a pool of bad bacteria, and this pool become very resistant against the antimicrobian organite. So this is the first thing. Second thing is they will use the sugar to feed themselves
to
grow more and more. And with this fermentation, they will create also acid. We call that organic acid. This acid will go through your enamel and reach the dentin, and it will damage the dentin. So usually it's fine because you have saliva. In your saliva, you have bicarbonate, who is supposed to neutralize the acidity. So everything is in control. But when you start to eat sugar all the time, the saliva is not able to keep up with this acid attack. This is the problem with the sugar. So as I mentioned before, all the sugar have not the same effect. The sugar where the most fermentable is glucose, fructose, and saccharose. So most of the sugar you find in sweets. Be careful with fruit juice or smoothie, because in fruits it's fructose.
Oh, yes.
Okay, so smoothie, it's not so healthy because usually you have a lot of fruits inside and quickly you have a huge amount of fructose, which is very bad. Same for honey, for example. Honey, it's a lot of fructose. So it's good in small quantity, but not honey.
Very interesting. Because most of the places now that I see on internet, we find like a lot of this, like, you can alternatives, like you can do honey, you can have lots of honey, it has got a lot of other health benefits and so on and so forth. But this is interesting to know that we need to always have it in moderation. We cannot say that, okay, since honey is beneficial, we can have lots of it.
And it's the same with agave syrup. I saw a lot the same on internet, very healthy sugar. You can alternate with agave syrup, but no, agave syrup, it's also a lot of fructose actually. So it's not so healthy
It's not so
neither.
healthy. Anyway, in busy lifestyle, like now here in Dubai, especially in Dubai, everybody is very busy and they all resort to snacks. In Dubai, if you see, there are many eateries out there which is like providing on-the-go snacks
Yes.
and quick snacks because that's what the lifestyle here is about.
Yeah.
So are there healthier snacks that's so easy and quick to make for people who are always busy? Because most of the time people don't want to cook for a long time because that takes away a lot of their time, and they're very busy, they come home tired, or when they're on their way to work they don't have enough of time to cook, something. Yes. So is there any healthier alternatives that they can resort to?
So I always say to my patient, I'm super busy. I'm super busy and I cook every night. So it's about organization. You just need to be organized. Vegetable, it's really easy because you can always find frozen vegetable. You just open the packet and boiled and that's it. So it took you 5 minutes. So I think it's just organization. You can cook several meals in a row like this. You don't have to cook every day, but yes.
So interesting that you said that. Like now, I have a question now. So when you say packed, frozen fruits versus fresh fruits or vegetables, isn't it better to go for fresh fruits?
So I would say here in Dubai, no, because vegetables travel a lot. So they are probably very poor in vitamin and mineral compared to your frozen. Usually they are frozen immediately after they are. Yes. So obviously don't choose natural frozen vegetable, not the one who are cooked with who are already prepared with industrial things. Yes. And
you mean the pre-prepared food, not that one. You're not talking about that.
Not that one. No. Just the frozen vegetable, and that's it.
That's it. How is it different to the other regular fruits and vegetables?
So you have to know that organic is not perfect. Okay, we know that, but it's a bit better because it's supposed to be less pesticide inside. It's supposed to be also more rich in polyphenol, so in antioxidant, and it's easy to understand why, because as they didn't receive pesticide and everything, they have to fight against the attack from the insect, from the weather and everything, so they produce a lot of polyphenol.
Thank you so much. Like, that is very enlightening. So what are the simple changes that people can make in their diet? Because I know that, people are so used to a certain lifestyle, a certain food, we could say comfort food. Yes. So they're very comfortable with certain foods. Yeah. So how can they make the switch to a healthier lifestyle? I
think, so as you said, it's very difficult to change food habits because food is linked with emotion, with a bit of everything. I think step by step. And the most important for me, it's to introduce vegetable for each meal. And it's easy. You can always grab some small tomatoes, cherry tomatoes, or just chew a carrot. So you don't need to take 1 hour to cook, no. And it's really easy as well, I think, to introduce spices. As I said, spices are really, really beneficial. And it's something quite easy for people. And I will say the last thing is change the fats they use to cook. So start to cook with olive oil because it's fine to cook it.
Now, again, in Dubai, the thing that most people like to do is to go to gym. There's a lot of activities over here. At the same time, there is also a rise in protein powders, protein shakes, whey proteins and all. What is your take on this?
So I love this question because it's very something I'm very worried about that. First, you have to know we don't need a huge amount of protein. Protein are very important, yes, but we need average between 0.8 to 1 gram of protein per kilo of body weight. People have tendency to eat too much protein and it leads to dysbiosis. Dysbiosis is perturbation in your gut microbiota. Okay, we call that dysbiosis of fermentation. And as I said to my patient, once they realize these shake of protein are not healthy, if you have a look in your gym, people will do a lot of
Body weight
lifting, and they drink the shake
shake at the
protein
same
and
time.
blah blah blah. Look the hair. Usually they don't have a hair. They lost hair because you overload the kidney and you lost your hair.
Okay.
And you can see all the bodybuilders, they have no hair. They lost hair.
Very interesting. Thank you so much for sharing that.
And plus, protein are very acid for the body. So it creates a lot of acidity for the metabolism point of view.
So in that case, what would be a better alternative to get the source of protein?
Usually, so you don't really need to have extra
Intake
voilà,
of proteins other than your daily
of protein, except if you do really bodybuilding. Obviously, old people need a little bit more to prevent the sarcopenia. So sarcopenia is when you lose muscles just because of age. It's physiological. But there is no reason. Usually, believe me, the main population eats too much protein. So don't be worried.
Drinking water is one of the most important factors. There's no competition about it, right? Like we need to drink a lot of water. How is it going to help our body, especially our oral health in particular?
So 60% of your body is water. It's very important, obviously. For oral care particularly, it's very important for saliva because the main content of saliva is water. And saliva have a big role in oral care, especially because she contains enzyme to digest your food. She protects your teeth and your gum against acid attack with bicarbonate.
Exactly.
It has also an effect of cleaning, auto-cleaning. For all these reasons, hydration is really important.
Do you see a lot of patients who are into drinking soft drinks like Pepsi, Coca-Cola drinks and all that?
I have patients who drink only soft drink. And soft drink, it's fructose.
Yes.
So you know this problem with the liver, we call fatty liver.
Fatty liver,
yes, non-alcoholic fatty liver, voilà, in English. Non-alcoholic fatty liver come from the overconsumption. Yes. Of soda, fruit juice, and syrup. It's the same effect as alcohol on the liver, but we call them non-alcoholic because it comes from fructose and not alcohol. You need to drink small amount of water, but regularly. So small amount, I mean 150 milliliter to 200 regularly. Why? Because otherwise the water don't reach your cells because it's what we want. We want the water in our cells. Otherwise you will just pee or do water retention. But when you eat too much salty and you drink, you have water retention because of osmolarity. Yes, the water can't go into your cells.
But some people, they add a little bit of salt in their water or sometimes lime. Is it something that you recommend? Because sometimes in our clinic, patients do come with sensitivity. The first question that we always ask is about the diet, the kind of drinks that they have. Obviously, when they drink acidic drinks, it is very evident. And if they say no, then the next question that we usually ask is, do you add salt in your water? And most of the time, that's their morning routine. They drink 1 liter of water with salt and then that kind of purifies.
Yeah, but it's, I don't think it's a good idea. Sometimes in nutrition, when we want to drain a bit the gallbladder or the liver, we advise to have lemon juice in the morning with hot water, but only 10 days maximum because it's basic for the body but acid for the mouth.
Yes, acid. And we also have people having a lot of coffee in Dubai. Coffee culture here is like crazy, right?
Yeah.
And there are people actually addicted to coffee. Like they have coffee in the office, they have coffee at home, and they have all this coffee stops everywhere in the mall, shopping malls.
Yeah.
And it's one of the most,
it's dangerous.
Okay. Yes. How is it dangerous? Like why do you say it's dangerous?
Coffee has good benefit on the body if you drink reasonably. So if you have 1 cup of coffee, it's fine. Me personally, I add my cinnamon on my coffee. I like to do it like this with almond milk, From cinnamon, I have antioxidant, anti-inflammatory effect. But if you take it too much, it's become bad, especially for people who have anxiety. Too much coffee increase a lot anxiety. So the tips I give to my patients, and I like to do as well, it's to drink only 1 cup of coffee. And if you don't like tea or herbal tea, okay, you can drink chicory. So you can find chicory in any supermarket in the bio section, in the organic section.
Okay.
And chicory, you have a kind of taste of coffee. It's okay, it's fine, to be honest. And it's a very good prebiotic for your microbiota.
Okay.
Very good effect. So voila, it's one.
I think we can put that in the show notes of this podcast. I think that's a very beautiful information for our viewers. This is something that is not on the mainstream. Nobody tells anybody this, but this is something I think many people will find value in it. Yeah. So if the listeners want to find you, they can book their appointment at Noralign. Yes. Noralign is also specialized in physiotherapy. Any other specific treatment that you are focused on?
Yes, my colleagues are specialized in pediatric physiotherapy and scoliosis. Me, I manage more the manual therapy, visceral therapy, and nutrition.
Perfect. So we'll leave your contact details, Noralign's details as well in the show notes, so that people can reach out to you directly.
Okay. Thank you very much.
Thank you so much for
inviting me.
Thank you so much for coming.
Thank you.